Hello, everybody. You're welcome back to my YouTube channel, Dr. K. Once again, if you haven't subscribed to my YouTube channel, you should consider doing that. Click that subscribe button and turn on your notifications. Watch a few of these videos. I mean, they are quite educative. You're going to love it. And let's go. Um, in the last 24 to 48 hours, there's been a new information given to us by WHO concerning a virus called the Mpox. Mpox, usually it was formerly known as monkeypox, but then they've changed the name. They've changed the name from coronavirus to COVID, and from monkeypox to Mpox, nomenclature. And then it was recently declared as an emergency, as a big problem. Not because it's affecting everybody in the world, but the reason why it was declared as a big problem was because they thought the more severe strain of the virus was contained in a country called Democratic Republic of Congo. And now they've realized that so-called contained severe strain has now gone into 4 other countries around there. If you recall, sometimes last year, there was this same outbreak in parts of southern part of Nigeria and some part of West Africa. But now it's become worse now. And then, and I thought, yeah, what a good time to bring the awareness to this. And, it will do a lot of good if you share this video to as many as possible people that you know, because they will learn a lot from it. And I believe you'll be sharing my videos too. Thank you. And so let's go. What is Mpox? Mpox is, part of is monkeypox, as I said earlier, member of what they call an orthopox virus. Is somehow related to smallpox. Many of us don't know smallpox. Many of us don't know smallpox. Back in the days when smallpox was an issue, that's when the vaccine came out then, and people got that vaccine a lot, But then this one is not as deadly as smallpox. Smallpox is deadlier, although they share the same symptoms. So the symptoms, begins with fever, headache, muscle ache, back pain, with some swollen lymph nodes here and there around the neck, around the clavicle area and the armpit area, Just like many other viral illnesses, how viral illnesses come, people who are familiar with COVID, same pattern, headache, body pain, fever. But now, what separates this from other types, is because this one has some, we call them rash, we call them papules, or papular rash, they become swollen around the body, and they contain water. And then these papules, they could burst open and have what we call scab. There's a hard surface that now grows over it after it bursts open. And when it bursts open, then it can now start spreading to other parts of the body. And I've seen pictures, even though I haven't seen a confirmed case of monkeypox, I've seen pictures, and oh boy, those pictures are not, they're not friendly at all. They're not friendly. And then monkeypox Mpox can be spread through direct contact with the blood, body fluid, or lesions of infected animals, especially monkeys. Monkeys, rodents, when you come in contact with these animals, like people who do a lot of hunting, people who do a lot of bushmeat killing and eating, yeah, they are very prone to it. And then also it can spread through respiratory droplets, and also beddings of somebody who is sick, like somebody who is sick of having the monkeypox virus. Then the person is exposed to is lying down somewhere, and then somebody goes to lie down near the person, or somebody goes to go close to the person, then it can become very infectious in that area. However, I'm going to touch on some very important part of this virus, important parts that will really interest us and really educate us, so that we can be able to educate others. That's why I was emphasizing on you sharing this video, so that people can really become aware and learn a lot, because most of this information on our social media, most of the false information are running around social media. I saw a few, and it's important to really, nip it in the bud so that you don't start to spread falsehood. How long does it take for this rash, or for this swelling, or for this boiling coat to start appearing on the skin? Usually it's about 6 to 13 days. Imagine somebody having it takes about 13 days before it eventually comes out. This 6 to 13 days depends on the baseline immunity of that person. Somebody who is quite strong in immunity might not manifest it until later, but somebody who has very poor immunity might actually manifest it earlier. Just the way viral illnesses, when your immunity is strong, viral illnesses don't really break you down. But when your immunity is poor, viral illnesses knock you down easily. So people say, how do we test for monkeypox? How do I know I have monkeypox? How do you know somebody has monkeypox? Usually it's just from clinical view. You just see the person, and by the time you ask questions, what do you do? Have you been exposed to somebody before? And there's that history start coming out, and then you can almost say that, oh, this person has monkeypox. Some people go the full length of doing what we call a polymerase chain reaction. That's PCR. What we did for COVID then too. Some people go the extra length to check when they take swabs or blood sample from the people who have been infected, but then it takes a longer time. You can make that diagnosis just right there and then. Then, how do we treat it? Very important. It's important to know that there's no treatment for this virus. We just try to wait it out and try to treat the symptoms that comes with it. Some people could take about 2 weeks, but it's very important that you hydrate because of the fever that comes with it. It's very important that you hydrate. However, there are vaccines that we use for smallpox then that can be very, very useful. Can be very useful for this particular virus. There's those vaccines that we use for smallpox. Yeah, people get those vaccines, and it's very, very useful. So there's this thing I saw online, and it really made me want to do something about it. The people were talking about is it really deadly? Does it affect only people in Africa? People, is it through sexual contact? Is it through man-to-man contact? I saw a lot of that. Okay, yeah, let's just put paid to it. The truth is, monkeypox is not as deadly as smallpox. The narrative out there is that, oh, monkeypox is as deadly. No, it's not as deadly. Howbeit, there is no illness that doesn't have the propensity to kill if not properly taken care of. But if properly taken care of, it is not as deadly as smallpox. Also, it says monkeypox or Mpox affects only people in Africa. But in reality, the fact that it was first discovered in Africa, it means we have more cases in Africa. But there have been reports in different countries outside of Africa, that have also reported monkeypox. But then, because it was first founded in Africa, we found out that we have more cases in Africa than in many parts of the world. And another thing that came was that you can get monkeypox through casual contact. He said monkeypox can be transmitted through close contact with an infected person. It's important. Infected, like the person has to be infected, and then the person has to have been showing the symptoms. Like the boil has to have been shown on the person's body. I mean, if you see somebody who is clearly sick of monkeypox, and you tend to go close to that person, yeah, but it is not as contagious, or it doesn't spread so much like COVID-19. COVID-19, surfaces COVID-19 respiratory droplets easily, the way it moves, but monkeypox is not as bad as that. You have to be in contact with somebody who is really sick of the virus, and also body fluid, as I mentioned earlier, body fluid, the wound itself, and other objects that the person has used, that you now using those objects, now you put yourself in harm's way. Then the one I mentioned earlier about only men who have MSM, men that have sex, with men, are the ones that are at risk of nah. Although, there have been reports in that group of people to be the ones who, have a higher form of exposure. But then, really, it could be anybody. From what I described earlier, it doesn't have to be a man-to-man. It could be from a patient to a doctor, from a doctor to his wife, from a nurse to the husband or the nurse's wife, or the relative of the sick patient. I mean, it's more of a person-to-person contact, not necessarily man-to-man or woman-to-man or woman-to-woman. No, it's more necessarily of a person-to-person contact. Now, to the most important part, now we know there's a problem. How do we prevent it? It's important. Vaccination is number one. People who are prone to getting close to people who have the illnesses, the health workers, they should be vaccinated. Healthcare vaccination is number one. Then now vaccinating people who are close to the people who have it, more like the relatives, or a subset of people who are prone to having monkeypox. Maybe some villagers that the virus has already come to the village, and then people who don't have it yet, have now been vaccinated. Then it's also very important to avoid contact. How there was quarantine during COVID? It's important to do some form of quarantine for most viral illnesses. Mpox is part of them, where you avoid contact with the person who is sick. I've mentioned this thing. The person has to be sick and having those lesions before you know that this person can't transmit. So, seeing a sick person, getting help, but avoiding contact with that person is very, very important. Both what the person's clothing, the person's beddings, it's very important to avoid contact. Also, hygiene practices. One thing COVID-19 taught us was hand washing, regular hand washing. Yes. Regular hand washing. In my infection prevention and control class back then, nothing beats regular hand washing, because every illness, every disease can be spread through the hands. So regular hand washing is very important. Using hand sanitizer, those things came out during COVID then, and it really taught us a lot. So hand sanitizer still is supposed to be used, and regular hand washing too. Isolation, as I said earlier, using the quarantine quote, people who are sick, separate them, until all the lesions have gone. When the lesions have gone and fallen off, then that person can say that they can be brought back into the society, because at that point there's a lower risk of infecting other people at that point. Also using personal protective equipment. This is majorly for the health workers. You see what PPE meant at that point. You wear your face mask, you wear your the body suits, when you're handling patients, So those are preventive measures. It's important to know that without prevention, we all just keep living in the world of speculation and also spreading this virus unknowingly. So it's important for us to learn prevention and also talk about the myth, so that we don't just spread falsehood. Spreading falsehood really does a lot of harm to us. That's all for this video. Watch this video, like it, give it a thumbs up, send it to as many as possible people, and also subscribe to my YouTube channel as much as possible. Thank you very much. I'll see you again next time.